Hi friends, it's Diane here. I am out here in the country after getting home from Victoria, BC. I just came back from speaking at the Canadian College of Health Leaders Conference, where I gave a talk on Listen to Lead. And I have to say, it was one of the most powerful conversations I've had in a long time. After the talk, I had leaders coming up to me. They were a mix of new leaders, experienced directors, nurse managers, nurses, physiotherapists, and also other high-level executives. And they all said the same thing, but in different words. And that was, I have great ideas. Ideas to improve patient care. I have ideas to transform our department, but I go to my higher ups or I go to my team lead and nobody seems to hear me. So maybe you felt this way too. Maybe you're a manager in a hospital department who sees a better way to do something. Maybe you're a nurse on a unit who keeps speaking up, but nothing changes. Or maybe you're leading a team, but it feels like your ideas just hit a wall. And if this is you, I want you to know you're not alone. And more importantly, you're not wrong. You're not imagining. It can really feel hard to get your voice heard in healthcare, but it doesn't mean that you should give up. In fact, this is where your leadership begins. So today I want to share 3 simple but powerful truths that will help you to get your voice heard without yelling, pushing, or getting exhausted or burning out. So these are truths that I've lived and taught both as a leader and as a coach. So truth number 1, leadership isn't about having a title, it's about using your voice wisely. And there's methods for that. You don't need to wait to become a titled or formal leader to start influencing positive change. You just need to learn how to speak in a way that makes people lean in, not shut down or ignore you. And so that means knowing who you're speaking to at a completely different level than you think. So understanding what it is that they care about, what's important to them, and how to frame your message so they can see the benefit, not just the problem. And so when you learn these strategies, which is really magical, people stop seeing you as maybe a complainer or somebody who has way too many ideas and start seeing you as a positive change maker who can help them with their biggest needs, right? And so truth number 2, people cannot hear you if they feel threatened. So this was a huge aha moment for me in my own leadership journey. So when we bring passion and frustration into a conversation, it can sometimes unintentionally make others feel judged or defensive, especially if they're your boss or if they have more authority than you. And so the key is this, is it's important to speak from curiosity, not criticism. Even though you don't mean to be critical, it can sometimes come across that way. And so it's important to ask questions, share stories, and invite other people into the conversation, right? And so this shift alone, just shifting into curiosity, can turn any resistance that you notice into openness, so that you don't even have to insist. You don't even have to over-explain. You don't have to justify. You don't have to raise your voice. You won't. There will be openness and it will feel much easier. Truth number 3, listening is your leadership superpower. And I know it sounds backwards, right? Because you're the one trying to be heard. So why should you be the one listening? But here's the thing. When you model real listening, you create safety. You create a sense of safety for others all around you. And in healthcare, safety is everything. When people feel safe with you, they naturally trust you. And when they trust you, they open up. They feel safe to be vulnerable. They feel safe to be curious. They feel safe with you. And when they open up in that way, they're much more likely to hear what it is that you have to say. And so if you're wondering how to do this without burning out or getting exhausted, that's what I'm here to help with. And that's exactly why I created I have a little program called the 30-Day Kickstart to Transformational Leadership. And Transformational Leadership has listening at the root of it. And it's an audio program. And this gives you a tool that is simple, it is powerful, and designed for real people in real healthcare jobs, right? So it's not some kind of fluff, it's not some kind of theory, it's actually what works. When you're busy, when you're tired, and you don't have time to read another leadership book or take another leadership certification or watch another leadership YouTube video, you can grab it right now. And I will put the link in the description below for you. And that also gives you the 5 shifts that every healthcare leader needs to make in order to be effective and to build trust in their work environment. So be sure to grab that. And if you want to have more direct support, if you want to feel more confident, calm, and respected in your leadership, and remember, this could just be, you could be an informal leader in your unit or your department. You could be a manager, you could be a director, right? I would love to invite you to book a free call with me. We can talk about your goals, we can talk about your team and your coworkers, and how I can support you through coaching, because you don't need to lead alone. And I remember back in my leadership journey, I've walked in your shoes, and I've lived the burnout, I've lived the exhaustion, I've lived the frustration of not being heard, but I've also hired coaches. I've also hired my own transformational coaches, and I began to learn and have breakthroughs and learning incredible strategies. So I would be honored to help you lead in a way that actually feels really good to you, and then makes a difference and makes your job easier, and then you can have more impact, right? So I will put all of those links below for you. I want you to, number one, subscribe here for more grounded leadership conversations. I'd love for you to share this episode with a colleague who needs to hear it. And if this message really speaks to you, please feel free to send me a direct message or book a call with me. I would love to hear your story. Because at the end of the day, this isn't just about leadership. It's about better patient care. It's about creating systems that actually work. And systems that actually work because we took the time to listen. And that starts with you. So thank you for being here, and I will see you next time.